Hello everyone, I made a new series for MRCS OSCE history stations. It will be stations that usually come on your exam. It will be recorded between a doctor and a patient. I will be the doctor and the patient at the same time. And also what I'm gonna say will be written on the screen. Enjoy. Unilateral tonsillar swelling. Hello, I'm Ali Babikir, one of the surgical doctors here. May I confirm your name and age, please? Hi doctor, my name is Anderson. I'm 67 years old. Nice to meet you, Mr. Anderson. Today I will be your doctor and I want to ask you a few questions regarding your condition. Are you okay with that? Yeah, that's fine, doctor. How can I help you today? I have a lump in the back of my throat. I'm so sorry to hear that, Mr. Anderson. Where is the swelling exactly? It's on the left side of the back of my throat. When did you first notice that lump? 4 months ago. Did it start suddenly or gradually? Gradually, doctor. Does it come and go? No, it's there from the day I noticed it. Has this changed recently, Mr. Anderson? Yeah, it's getting bigger. Is there any specific time during the day that the lump increases in size? No, it's the same throughout the day, but it's getting bigger day after day. Okay. Is there anything that makes the lump increase in size? No. Is there anything that makes the lump decrease in size? No. Have you noticed that the lump rapidly increases in size? I already answered this question, doctor. Yes. Yeah, I know you answered it. I just want to confirm. Have you noticed a change in your voice? Yeah, I have hoarseness. How has your appetite been? Bad, doctor. I eat way less than what I used to. Have you noticed any unintentional weight loss? Yeah, I lost a lot of weight. How many kilos over how long? I'm not sure, but my clothes became loose. Have you or your partner noticed snoring while sleeping? No, she didn't mention anything like that. Do you have difficulty during swallowing? Yeah, it's getting difficult recently. Have you noticed breathlessness? Yes, sometimes. Have you noticed night fever? No. Is the swallowing painful? I answered this question, doctor. Yes. Have you been ill or having fever recently? Obviously I'm ill, but I don't have fever. Have you noticed a wheezy chest? No. Have you noticed a cough? No. Have you noticed tummy pain or swelling? No. Have you been abroad recently? No. The last differential you have is a symmetrical anatomical position. This will be present since birth and the patient won't be sick. Just consider it as a differential. Do you have any other medical condition, Mr. Anderson? Yes, I have diabetes and hypertension. How are you dealing with them? I'm doing my best to keep them under control, but it's not easy, doctor, you know? Yeah, I know exactly what you mean. Do you take any medications? Yes, metformin and lisinopril. Have you ever had surgeries? No. Do you have allergy against any drug? I don't have any allergies. Do you mind if I ask personal questions? That's fine, doctor. Carry on. What's your occupation? I'm a carpenter. Who is at home with you? My wife and my youngest daughter. How old is she? 14 years old, doctor. What's her name? Anna. Nice name. Thank you, doctor. Do you have any difficulty with the stairs, Mr. Anderson? No. Do you smoke? Yes. How many packs per day? 1 pack a day. Do you drink alcohol, Mr. Anderson? Yes. How many units per week? You can say around 18 units a week. Just for your information here, 1 unit equals 10 ml or 8 gram. Is there anyone else in the family who has had a similar problem? No, no one I'm aware of. Before I go any further, could I ask what do you think the cause is? I don't know, but I hope it's not a cancer or something bad. Don't worry, Mr. Anderson. We will figure this out. What are you the most concerned about? Death, doctor. Oh, really? So are you anxious right now? Of course, doctor. I'm very anxious. I totally understand that, Mr. Anderson. I want to assure you we will do our best to help you. What are you hoping for us to do for you? Fix me, doctor. We will do that, don't worry. Any abdominal pain? No. Any problem with urination, Mr. Anderson? No. Any muscle or joint pain? No. Anything else you want to add, Mr. Anderson? No, thank you, doctor. That's all. No worries, it's my duty. I will speak to my senior and get back to you shortly. Thank you, Mr. Anderson. Then you will have the discussion, which will be 3 minutes. Present your patient. And I always advise you to train yourself to present your patient, because this is the first impression of the examiner about you. The examiner will ask you to present your patient. Present your patient. I took a clinical history from this gentleman, Mr. Anderson, who is diabetic and hypertensive, 65-year-old male carpenter, complaining of right unilateral tonsillar swelling. He noticed it 4 months ago and it has been increasing in size. He lost his appetite and his weight is declining. He has no fever, no night sweat or family history of the similar condition. He developed hoarseness and difficulty breathing recently. He smokes 1 pack of cigarette a day and drinks 18 units of alcohol a week. How will you investigate your patient? I will perform simple full blood count. I will look for raised white cell count, which we usually associate with infection. Then I may perform tonsillectomy for biopsy with flow cytometry, CT scan or PECT to rule out lymphoma. PE stands for position emission CT to rule out for lymphoma. Pan endoscopy, which include examination of the upper aerodigestive tract, including the pharynx, larynx, upper trachea, and esophagus. I will also perform urea and electrolyte, looking for renal impairment if the patient has decreased oral intake. I may perform liver function test for any dearrangement, which may indicate glandular fever or metastasis. I'm going to also perform monospot test to detect any glandular fever. What is the significance of his occupation? He's a carpenter and wood dust is associated with nasopharyngeal carcinoma. How will you treat your patient? I will discuss the treatment in a multidisciplinary team, including my consultant, oncologist, and anesthetist. Then we will do staging using MRI neck, CT neck, ultrasound of the liver. Treatment, surgical or radiotherapy. Surgical is block neck dissection, which has 3 types. Radical block neck dissection, modified radical block neck dissection, or selective block neck dissection. Okay, thank you. You can go to the next station. Thank you.